Hello, I'm Rachel Miller. I am the System Division Chief for the Division of Clinical Immunology here at Icahn School of Medicine at Mount Sinai. Seasonal allergies are sometimes commonly known as hay fever, and allergies can affect the nose and the eyes, and they could cause congestion, sneezing, sore throat, fatigue. The symptoms can be triggered during certain seasons by pollens, like now during the spring season when the trees are pollinating, or say during the fall by ragweed pollen when that's pollinating in high levels. The symptoms also can be unrelated to season if they're triggered by exposure to dust or animals that are year round. So some people with allergies also develop allergic asthma. In that case, the inflammation is more focused on the lower airways than the nose area, and that can manifest as trouble breathing or wheeze. Well, allergic rhinitis, whether it's seasonal or non-seasonal, occurs in people who are genetically predisposed but are also re-exposed to the triggers in the environment. And the symptoms can be worsened by other factors that are unrelated to allergies, such as stress or exposure to air pollution. Well, there are a few ways. The first is to identify the triggers, and they differ for different people. So the triggers can be assessed by visiting an allergist immunologist who can perform a skin test or blood test after taking a very careful history. And if it's tree pollen, for example, if that's identified as the trigger, well, then the recommendation may be to wear hats, sunglasses, remove the shoes and showering when you come back inside, especially during the springtime. And that can help minimize the exposure. But say for a particular person, the trigger is dust, well, then the recommendation may differ. And it may be to avoid sweeping in the home and instead to use a vacuum or to mop. We also treat with medicines. So we have lots of medicines now to treat allergic rhinitis. Some are sprays, some are pills, some are eye medicines, and they're usually very well tolerated. But if someone can't tolerate the medicines very well, or the symptoms continue even when on good doses of medicines, then we have a conversation about allergy immunotherapy, either given as injections, also called allergy shots, or sometimes as medicines under the tongue, and that could be considered as well. Well, sometimes the exposure can cause a serious allergic reaction. It could even be life-threatening, and then it's called anaphylaxis if it affects the whole body. And that can occur after eating, say, peanuts or being stung by a bee or perhaps receiving an antibiotic like penicillin in someone who happens to be susceptible. In that case, the exposure needs to stop immediately. And if the person's feeling any swelling in the airway or trouble swallowing or trouble breathing or feels faint, then EpiPen may need to be used. Well, an EpiPen contains adrenaline, and that's prescribed for someone who has a history of anaphylaxis, so that in the unlikely case that this recurs, the severe allergy, the person is prepared with an antidote. There's no need for an EpiPen if there's no personal history of reaction, and there's no need for an EpiPen if, say, a family member has a history of reaction. Well, if someone has a history of eating a particular food, and then gets a rash or a swelling or trouble breathing or trouble swallowing, I definitely would recommend that the person sees an allergist immunologist. Now, the tests are only accurate if there is actual personal history of reacting to that food. Otherwise, the specific test is not so specific. If there is no history of reacting to a particular food, then the test could give something that we call a false positive. There is really no reason to test the family member unless the person that you're talking to actually has a personal history of a possible reaction to that particular food. Now, there are lots of types of tests. They could be skin tests, they could be blood tests. We even do sometimes oral challenges in the office when someone's actually given, in a very monitored setting, a little bit of the allergen to see if, in fact, there is an allergy. And the allergist would work with you or the patient to make sure that the appropriate and safest approach is taken.